Hello, ladies and gentlemen. Welcome on into another Rooted podcast, of course, brought to you by our awesome friends over at Green Bros, home of the world's leading cannabis harvesting solutions. Tim Strommel coming to you from our beautiful Rooted production studios out here in Denver, Colorado. As always, thanks for tuning into the show. Now, before we jump straight into our interview today, quick reminder that you need to hit the subscribe button so we can make sure you're getting upcoming episodes as they are released. We have some really cool interviews upcoming that we can't talk about yet. Hopefully by the time this podcast comes out, we're making those announcements on our page. So follow us at Stay Rooted on social media so you don't miss those as well. Also, don't forget to check out Rooted TV, our bi-weekly web series airing on High Times TV, Cannabis Club TV, StayRooted.com, and of course on YouTube as well. Okay, cool interviews there. We just interviewed Tommy Chong and Jim Belushi not too long ago, so go check those interviews out if you want. For this show today, we have a really interesting one for you as we're about to welcome in medical doctor of Dr. Jane, the guy who started it, right? Oh God, here we go, buddy. I'm going to get this right. Luis Enrique Liogier-Weyback.
That was actually the closest anyone has ever gotten it. That's actually pretty damn cool.
Yeah, that's fantastic. Well, I got to tell people, you phonetically spelled it out for me in our pre-interview, so I'm totally cheating. But I got to say, first time through, I think I nailed it. I
think you did. Good job.
And then going forward, should we just say Dr. Rick? Is that the way to go?
Rick is the easiest thing, man. I'm super informal.
Sounds good. Now we're going to be talking about his crazy journey that led him into the cannabis space. He's an expert on the endocannabinoid system, so we're going to get into that a little bit and why and how CBD works with your body. And since CBD is having such a positive impact on certain medical applications, does that mean we're deficient in CBD? Is that why this is having such a good reaction to us? Who knows? We'll talk about it on the show this afternoon, so stay with us, okay? We'll welcome in Dr. Rick in just a second. Before we do, a quick shout out to our sponsors over at Green Bros, home of the world's premier dry harvesting solutions. From small-scale cultivations all the way up to your Big Daddy commercial grows, Green Bros dry trimmers, trichome extractors, destemmers, sorters, precision batchers, the box, rosin presses, their new Model M trimmer. All these things want to save you time, money, and labor while making your cultivation operation more efficient and true to the plant. Check out greenbros.com or call 844-DRY-TRIM to schedule a free demo in your area today. That's 844-DRY-TRIM. You can also check out Green Bros at the Lift Show in Toronto, June 6th to 9th, NCIA San Jose, July 22nd to 24th. And if you love to plan and you're going to be in Vegas this year, MJ BizCon Vegas on December 11th to the 13th. So make sure those plans are made if you're in the area, okay? Okay, without any further ado, we're going to welcome in Dr. Rick. He's the founder of Dr. Jane. You can check them out, drjane.com. They are South Florida's most discreet, professional, and convenient medical cannabis practice. So a lot to unpack right there. First off, Dr. Rick, welcome onto the show. How are you, man?
I'm doing awesome. Thanks for having me, Tim.
No problem. And I know you said calling you Rick is fine, but I'm going with Dr. Rick because people need to know that you are a medical professional. We are going to get through your backstory because it is quite impressive and we've got a lot to cover. So before we get into your backstory, give people a little hint as to what Dr. Jane is all about. Give me the elevator speech on what you guys are doing.
Yeah, so really what it is long story short, what I set out to do, along with my wife, who's actually originally trained as a psych nurse, but she's actually a hospital administrator now. She and I both work in wellness and psychiatry, and what we started seeing as we kind of set out down this road is it's not a very good system where we're asking patients to have them come into these clinics to evaluate them for medical cannabis. Especially down here in Florida, it's really the new version of the pill mill. And these are quite literally just rat houses in some instances where we're having patients go into places where they really don't want to be seen. It's really a place where it's not, great for privacy. And so we came up with the idea that, well, screw it. Like, if I was a patient, I wouldn't want to be seen there either. So why don't I have the doctor come to my house? And so, that's exactly what it is. It's, me or someone like me, equally, as professionally appearing and trained. And, we go to your home, your house, wherever you're going to feel most comfortable. And I've seen people on their boats, at the sidelines at a Dolphins game. So we really just try to try to provide really, really personalized, individualized care. So.
Okay, so before we dive too far into that project, I have to get to your backstory because it's pretty unique, and I love talking about backstories on this show. Now, You're out of South Florida now, but you grew up playing ice hockey for 22 years. I don't think of South Florida when I think of ice hockey, so I'm going to guess that you're not from Florida. Is that right?
No, I'm not. Actually, I grew up in and around Philadelphia. So definitely a hockey bed.
Exactly. And then you go to the U.S. Naval Academy where you get the beginning of your medical training. You played hockey until medical problems forced you to shift gears, right? Tell me about the hockey you played, because that's super cool. You played for so long. And then what happened that made you kind of start this next chapter of your life?
So I like most hockey players, I started playing at a very young age. If you talk to, especially, the guys that make it up to the show in the NHL, they start playing really like as soon as they can stand up. And so I started playing just a little bit after that. But I had already racked up about 13 concussions before I even made it out of high school. And one of those landed me in a regional trauma center outside of Philadelphia. And so I had some blood on the outside of my brain, and I was taken care of by a neurosurgeon. And, that kind of started me down the road of, I really like brains. I really like, I really like this, cool stuff that not very many people can do. But there's a lot of military in my family. And, so, my dad's dad, my grandfather, they retired really in the backyard of the Naval Academy in Annapolis. And so, in addition to hockey and medicine, I grew up with, the Naval Academy right there. And that's the only school I wanted to go to. I wanted to serve in the military. And, I played hockey there, and then I blew out my knee. And so it was definitely bittersweet, getting a medical discharge from there. But I would say it kind of turned out okay, because it let me really pursue my biological sciences, and then eventually my medical degree. So at least a little bit earlier than would have otherwise.
So then I don't always get access to interviewing people that have such a medical background like you do. Could you give me an idea as to your medical training and what your specialties are, kind of like what you were doing throughout your young professional career in the medical fields?
Yeah, so I finished up my undergrad. I had a dual degree in chemistry and biology, so that's really the road that pretty much all pre-meds take. Then I actually went to grad school before I went to med school. I went to the University of Pennsylvania. I focused on neurosciences. I also took a little bit of a roundabout way of getting into med school, because I wanted to make sure that that's what I wanted to do. So I went to work in the completely opposite direction. I worked for Apple before I went to med school, just to make sure that, that's what I really wanted to do.
What were you doing for Apple? I mean, I don't hear medical professional and Apple very often relating to each other.
I'm a huge tech nerd, and actually you'd be surprised. I worked with, at the same time, I think we ended up having 6 people that ended up either being in med school or ended up going to med school that I ended up working with. And you don't really associate it with that, but we had, like I said, med students, doctors, lawyers, PhDs that worked there. And it was just completely eclectic group. I've carried a lot of that experience with me. But I ended up going to med school in Eastern Virginia med school, so that was another 4 years. Then I ended up matching into neurological surgery, so neurosurgery, and that is a 7-year training period. I started doing that in Charleston, South Carolina. And I actually ended up leaving my training a little bit early because my wife got sick when we were pregnant with our only daughter. And you can't really work the 100 to 120 hours a week with a sick spouse. And then as we're going through all this, we found out that I actually have a tumor myself. So just had to kind of take a step back, and that's where we ended up in South Florida. We needed a change, and we wanted some sunnier weather, and ended up doing some men's wellness stuff. And specifically, I wanted to work with hormones because that's what that brain tumor doesn't allow me to make, is a lot of those hormones. So I kind of already had the perfect excuse to pursue it. And then we kind of get into the whole cannabis thing.
That sounds like a lot of life experience. What are you, like 55, 60? I mean, you're like 5 years here, 8 years here. You don't look that old.
I'm just 33.
It's got to be the water down in Florida, man. I tell you, it's just youth down there, youth and sunshine. But let's round back to the cannabis space, like you said. Now, Dr. Jane, what you're doing now is really spreading a lot of education. You're helping patients with cannabis therapies and treatments. You're coming from a place of like mainstream medical background, medical science. And there's only really, I've only dealt with a handful of people that have made that transition. I think the medical field overall is still really figuring out a lot of this and how to teach it and how to get people your age, that next level, that I don't want to say millennial medical professional because you're a little older than the millennial category. But are you noticing that change in the medical field? More people are starting to try to figure this out, or is it still kind of closed off?
I would say it's a mix of yes and no. It's kind of a non-committal answer, but it depends on the specialty. And actually, a lot of the specialties that you would at least initially think that would be, very pro cannabis, pro CBD, actually turn out not to be. So actually a lot of the, primary care, your pediatrics, your family medicine, internal medicine, they're actually very closed off, at least in my experience. And then oddly enough, some of the traditionally very, very conservative specialties, like a lot of the surgical specialties, are actually becoming very open to it. And so I had the pleasure of meeting and speaking with Adam Abadili at one of the conferences that we were both speaking at in Indianapolis. And he's a colorectal surgeon. And, he and I got to talk, and we kind of both said the same thing. And it really helps with surgical recovery, both on the post-surgical pain aspect, and then just actually on the tissue healing side. So it's, again, it's a yes and no, but it's a very unexpected yes and no.
It's interesting you mentioned that, actually, because we interviewed Tommy Chong a couple episodes ago on our show, and he dealt with cancer a couple of times, including like a rectal cancer, where he had to use cannabis suppositories that really helped him with that side. So super interesting you tie that together. Now, you come from an expertise in neurotrauma, neurocritical care, neuroendocrinology. I'm trying to pronounce all these things right. Hypothalamic pituitary gonadal signaling, biochemical pathways and regulation to the endocannabinoid system. When did you find out about the endocannabinoid system? Because I know it's not taught in a wide scale, right?
Yeah, there was a 2017 American Association of Medical Colleges survey on it's basically the curriculum committee, and it showed that in 2017, so less than 2 years ago, less than 9% of North American medical schools. So really, what they're looking at is the United States and Canada. So allopathic MD schools, less than 9% of them have any amount of teaching about cannabis, the endocannabinoid system, CBD, anything related to it. And when we say teaching, it's like maybe 45 minutes. So I was fortunate enough to get my jump on it as an undergrad, actually. So I was actually a lab research assistant during one of my senior biochem courses, and we were doing some rat experiments, basically inducing strokes in these rats, and then giving them synthetic endocannabinoids, and seeing what the response was, and seeing how much neuroprotection there actually was at different time points of administering it. And this is well documented that it actually really does work. It has a significant impact. I mean, the U.S. government holds a patent on this stuff, so it's it's no surprise that it really does work. But it's just something. It constantly surprises me that something that is so impactful has so little, it's just not taught. Like, you
it's
have to
crazy. Like,
stuff out.
Imagine going through all of medical school and then finding out, like, on the last day, oh yeah, there's a respiratory system we should talk about. We don't have a lot of time for it, but that's almost what I feel like has been done, because by not acknowledging it, you're leaving out this part of the body, and a medical professional like yourself is trained on the whole body. It's a lot of these things are full body problems that you need to think about, and it's just nuts.
It absolutely is. It absolutely is.
So I mean, I don't know what kind of listenership I have in South Florida, but let's shift gears back to Dr. Jane for a second. Tell me about the concierge medical services you provide, and why you chose to go that route in providing them.
So what we do specifically is, and again, this goes back to what I saw personally, and what all of my patients have time and again told me about their experiences with cannabis physicians, not only down here in Florida, but what you've heard from any number of patients coming from, like, California, things like that, where it's really, oh yeah, you have pain, okay, give me your money, here's a card, bye. That is not at all how this should work. This should really be treated like any other medical specialty. So, like, medical cannabis is not for everybody. High cholesterol medication is not for everybody. Surgery is not for everybody. Okay, so that's really how it should be treated. And that takes time to actually figure out. Like, you actually really need to sit down and talk with a patient. A lot of these patients, I would say, honestly, maybe about 80%. Yeah, actually about 80%, if I'm being honest. They really just need somebody to talk to. And that's really what a lot of this is. It's especially, the patients. I work with a lot of veterans, and they have a lot of the PTSD, the generalized anxiety disorder, and I'm finding that I'm simultaneously playing physician, social worker, counselor, and it's not only that I'm talking to the patient, but I'm talking to the family members too. I'm talking to the husband, the daughter, the parents. And then all of a sudden, you start hearing all this other stuff in the background, like, oh yeah, I think I have that too. And I was like, okay, well, I'll talk with you in a sec. And every single time you just sit down and spend time with the patient, it's, even if they don't, qualify, and I hate saying qualify, but you have to say it because it's, you are operating on, within the parameters of the law. Even when the patient doesn't qualify, it's like, I'm still providing a medical service for them. And that's the whole thing. I think that's what a lot of physicians either unfortunately have forgotten, or just don't think that they have time to do, or don't want to do. They kind of see this as, well, the patient's my ATM, and this is kind of the new fad. So no, just treat them and treat them. No, like, these are people. They unfortunately have been kind of ostracized because, they've been on pain meds for a long time and stuff like that. And so I know I'm rambling, but I get really passionate about this stuff, because a lot of these patients are unfortunately just kind of cast aside, and they need somebody to have their back. So that's kind of where I hope that we're filling that need. So.
And you can check them out, drjane.net. Sorry, I used the .com earlier, drjane.net. Of course, I will link that in the description of the podcast below, so just scroll on down and click it. So now there's a couple of things they can do with you, and I want to get back to the endocannabinoid system in just a minute.
Yeah.
But there's a couple of things they can do to learn more about the company, to take advantage of your services, or to check out the CBD products that you vet and add to your site as well. How do people go about reaching out for you to get some of those medical services?
Yeah, so actually, probably the easiest way is actually just going right to the website. My contact information is freely up there, so you can call, text, email. I always respond. I always have my phone on me. I give my cell phone out to my patients. That's not something that a physician should ever be afraid of. You want your patients to call you. You want to be that guy. That's kind of why you're supposed to get into medicine. But you can. We do a lot of education, especially through the blog on there, and I think that's the biggest part of that website is patient education. So I encourage anybody to go on the website, read about the stuff that we do. We have a lot of relevant updates as far as legislation goes, different medical updates. There's a store, our store is on there, and the only stuff that I allow to go on the store are products that I have personally vetted. Like I've physically been to the labs and seen, stuck my head in the vats and stuff. Like I know the owners and the pharmacists. So I'm not going to let my patients take something that I wouldn't take myself. But you can make appointments right through the site. You can text me and say, hey, I want an appointment. What's your availability? And I'll schedule one for you. So I'm super open.
And then how does it work? Is this just like throughout the state of Florida, or are you allowed to kind of consult everywhere?
So as specifically for medical cannabis, it's only in the state of Florida, at least for right now. But no, if anybody has questions, doesn't matter where you are, I'm always available to answer questions. Doesn't matter if it's, what type of CBD do you think I should take? I'm already a medical cannabis patient, but I have questions about what exactly am I taking? Will this have an interaction with the meds that I'm on? Is this something that's even right for me? Stuff like that.
Very interesting stuff. So now let's jump back to the endocannabinoid system. You were right there, you said, in your undergrad, in your senior year, testing this on rats and stuff like that. Did you figure out how CBD works? I mean, like, no one's really out there saying, okay, CBD enters your system and here's what it does. Like, I had one person, a doctor that was working out of, I think it was the University of California, San Diego, or it was somewhere in San Diego, okay? And they explained it to me like CBD kind of goes through imagine your mind is a hallway and all these doors are locked, and CBD would go in and kind of unlock doors in your brain. That's the one way that I've had it explained to me that kind of makes sense. But how do you explain it when people ask, how does this work?
So it's... So number one, it's certainly not an easy explanation, okay? Because frankly, we don't know everything about it. I would venture to say that we know maybe 30% of it. All right, we are finding stuff about this every single week, which is actually kind of one of the really cool reasons to be involved in it, because you can be part of a new discovery. But CBD, cannabidiol, is one of many, many, many cannabinoids. And, well, frankly, I listen to your podcast all the time. So I know that you have a lot of authorities on cannabis and the cannabinoids in general. So I know this isn't really anything new to you or any of the listeners, but the cannabinoids themselves, it's not that our bodies were built specifically for, with receptors for those cannabinoids. It's that we are built with these receptors that cannabinoids just happen to fit into. And that's how we discovered them. And so, Meshulam in the late 60s, so he's an Israeli PhD. He's really considered the father of, or the grandfather of cannabinoid research. So that he was really the first one to characterize, THC and what is this thing that actually binds and gives you these effects in the brain. So THC, we've come to find out, has an affinity for the CB1 receptor, which is the one that when you tickle it and make it do stuff, it can make you high, among other things. So CBD, contrary to popular belief, actually does have an effect on the CB1 receptor. It actually kind of changes the conformation of it, so it doesn't allow THC to bind on it. So actually CBD does actually hit the brain, but it hits a ton of other body systems. And so does THC. So does CBC, CBN, THCV, THCA, all of these other ones. There's over 220 terpenoids and flavonoids, and then several hundred cannabinoids. So I mean, the bottom line is the endocannabinoid system is a well preserved across all animals that have a backbone. It's a system that we're born with that helps us regulate a lot of different body systems. Okay. And it works a little bit different from, say, neurotransmitters in the brain, where they're constantly firing from the central nervous system outward. These are actually firing from the periphery towards the central nervous system. And these are actually the transmitters, the endocannabinoids, are made in response to something. Okay, so that's actually kind of a key concept. So this is something that our body actually senses, hey, something's wrong, let me try to fix it, versus, oh, let me just send a signal. Okay. So it's a really cool thing. A lot of pathological processes are actually, there's actually a fantastic quote. Let me end it with this, that in one of the recent landmark papers that said, and I'm paraphrasing here, that almost all pathological processes can be tied to some sort of deficiency or abnormality with the endocannabinoid system. Okay, and that should tell you something.
And that's exactly what I was going to lead into. Do you think that, and I have a theory on this, and I can share, I guess, after I ask you the question, but do you think that certain people maybe are missing basic levels of cannabinoids in their system, since it seems like adding cannabinoids to people in certain medical treatments or people dealing with things can have an effect that cures it? Does that mean that some people just have a deficiency? Yes.
You want to know what it's called? It's a very creative name.
Go ahead.
Endocannabinoid deficiency syndrome. No, that's actually really what it is. Yeah.
So to expand on that, I interviewed another doctor. I mean, this was years ago with a different media platform. And the way he explained it to me, I want to get your opinion on. He explained it as if when sailors crossed over from Europe to the U.S., a lot of them got scurvy because they were deficient in vitamin C. And so they developed a scurviness. And the comparison he made was in the 20s when prohibition of cannabis started. Now we're into generations 2 and 3 times past that, where not only has cannabis been out of the mainstream, but a lot of hemp products. And what he pointed out was interesting, that a lot of dairy-raised animals and cows and stuff like that were raised to eat hemp in fields. And that was part of their diet, which would get them CBD in their system, which then when you ate the cow or you drank the milk would give you those endocannabinoids via transition. That's what he was saying to me. And so when you remove that hemp and cannabis from part of that ecosystem, it can create deficiencies in future generations, which I thought was really interesting, and no one ever talks about it. But do you think that's kind of a plausible reason why we're seeing all these diseases that maybe weren't as popular early on in the 1900s that have kind of popped in now?
Plausible, yes. Whether we can say that there's causality, I don't know if we're there quite yet, simply because now that we're at the point that we can actually, that we have the technology and the wherewithal to actually answer some of these questions, we hemp and cannabis has been out of the diet and the mainstream nutrition for several generations now. So we can't really say, like, is it the chicken or the egg?
Yeah, and you can't go back and figure out what people's systems were like. I mean, I don't think there's any sort of way to do that. It's absolutely crazy. But what do you think? Is there any sort of underlying cause, or is there any speculation, I guess, in like medical communities as to what any possible underlying cause could be as to why these endocannabinoid deficiencies are happening?
I mean, there's certainly speculation, but as far as what evidence there is, and that's really what has to be the standard, we don't really know just yet. Like I said, there's correlation and there's causality, and a lot of what the sensationalism that's going on today is trying to link correlation to causality. Mm-hmm. It's an improper thing to link, and whether we can try to make the same leaps on the scientific side, I really genuinely don't know. I don't know if anyone actually knows that.
And these are questions that I'm just thinking of right now. So I feel man, why isn't like this research being done? I guess to last question I'll say on this, but we've established that there is a term of an endocannabinoid deficiency being applied different places. Are you seeing them applied to any specific like ailments? I know that seizures and what was the state? Oh, Colorado, where I'm at. They just passed the use of medical cannabis and CBD to be used in minors with autism.
Spectrum disorder.
Yeah. So are they linking endocannabinoid deficiency to any specific ailments? I'm guessing also that stuff that's still being tested.
Yes.
But are they making unofficial correlations yet?
Well, what we have very definitively seen, and here's the key: it's reproducibility. So we have seen this over and over and over again through different studies, that different disease states will cause or yield a very specific and again reproducible or set of circumstances. So in Parkinson's, there's a and also Alzheimer's, there's a certain characteristic distribution of the CB1 receptors in the brain, in certain regions of the brain, and the more you kind of do what we're doing here, but in a much more scientific manner, where you're really kind of tossing these ideas back and forth, but you're then validating them with experiments.
That's where my involvement stops, by the way. I'm an idea guy, but then I don't know anything else.
So as a quick aside, though, that's the beauty of this field of research and science, is that's literally what we're doing. That's kind of the whole fun of it. You say, well, what about this? And you can't really say, no, that's stupid, because, well, we don't know what's stupid.
That's a great point, because, I mean, in the medical field, how often do you discover a part of the body that you can go and see that, okay, maybe there is some research, but the bulk of it is still there to be had. This has to be one of the last remaining free ranges in the body that people haven't had a chance to really get that research done, right?
Yeah, no, it's this in the brain, and Oddly,
and the appendix.
Interesting.
Right? People need to figure out finally. I mean, I think people have just given up, right? Don't need it. It's in there though.
You can ask Adam about that one. But going back to your original question, like, we have, continuously seen that, in these disease states that these receptors, and they're upregulated as basically the body's way of trying to cope with what's going wrong. And so, if an increased CB1 stimulation is what's going to help, specifically with Parkinson's, they have a tremor. So what happens when you stimulate CB1? Think of what happens when somebody smokes a lot of weed. Well, they kind of really calm down and they're not really agitated. Okay, well, when someone's got a lot of psychomotor agitation, just think, okay, if I get them to do something where they really calm down, that helps, right? Okay, so the brain is kind of trying to set you up for that. So it massively overproduces these CB1 receptors so that when, on the flip side, your body starts producing the endocannabinoids that stimulate the CB1 receptor, oh, okay, in theory, that would help, right? So your body's trying to set you up for that. And so there are a lot of different disease processes where we see that same type of at least partial, setup for recovery. And so that's really what lends a lot of credence to this as, this is all homeostasis. This is your body trying to get back to the middle, trying to get back to the status quo.
Once again, I want to let you know this podcast brought to you by our great friends over at Green Bros, home of the world's leading cannabis harvesting solutions. And Green Bros just announced the launch of their new Model M dry trimmer, which takes the amazing traits from your Green Bros 420 model, ramps everything up a notch. We're talking full surgical stainless steel construction, and an impressive but simplified design means this new dry trimmer puts up serious volume while being easier to break down, clean, and reassemble, because all regulations basically are saying you have to clean it before you put in a different strain. So it's very important to have that repeated process be very fast. The control panel has also been moved away from the machine so you can power wash it, scrub it down, all without fear, speeding up your turn time, processing even faster than you ever have. Also, the new stainless steel design means no nooks, no crannies, ensuring that your machine stays clean and compliant with regulations for now and for years to come. Just another Green Bros machine you have to see to believe. Hit them up, 844-379-8746. That's 844-379-8746 or info@greenbros.com. We're talking with Dr. Rick on the show. He is the founder of Dr. Jane. You can check him out, drjane.net. Couple more questions for you, man. I think I do have a lid on my endocannabinoid questions. I can't promise. I might have one or two more.
Don't ever put a lid on it.
You know what I mean? Well, I guess here's what I was just thinking about also is, does the endocannabinoid system, like, I know the brain takes, years to mature, and they're, 18, 20, 27 years before certain parts of your brain might be done growing. Do we know if the endocannabinoid system goes through a growth process, or is it just, okay, here's your system, it's the same day one as it is at the end? And I know I might be outside of any purview of current science.
Fantastic question. I don't even know if that's ever actually been asked. So seriously, man, get on that.
Yeah. I just got about 10 years of school to go through, and then I'll figure out how to actually study this stuff. But I think that's just interesting because I mean, it seems to help kids with like epilepsy, but it seems to help epilepsy and things like Parkinson's at all age levels. So I'm very curious as to what that means, but we can save that for another day because I don't know. I'm inquisitive today. I guess you're drawing it out of me.
That's good. That is a good thing.
Yeah, my wife will be happy. I'm not saving all these questions for her. Now, in terms of entrepreneurship, we love talking about that on the show. We love to ask our guests, many of whom run their own brand or company, what they're doing, about entrepreneurialism and stuff like that. Are there many chances for doctors to be entrepreneurs in the medical field?
There are. It looks very different in different specialties. So to give you an idea, in neurosurgery, but really it's kind of the same thing throughout all surgical specialties. Generally speaking, that entrepreneurship is going to come by way of device development, or depending on whether you're really active in the lab, then it might be working with a pharmaceutical company, and developing a patent for something. In what like in kind of what I'm doing, yeah, there's tons of opportunity. It's just a matter of kind of getting outside of the blinders, getting your head out of the sand, and kind of just looking up and saying, all right, what's wrong and what can I do about it? As you go through your medical training, unless you've gotten an MBA or you have a particularly savvy mentor, you're generally taught that money is evil in medicine. So you never, ever, ever want to think about it. And me personally, even though I'm a business owner now, I still have a really hard time collecting my fee from my patients, and they'll ask me, they're like, okay, so how much do I owe you? And I'm like, oh, it's like $300 and they're like, what, I didn't hear you? I was like, I don't know, I hate telling it. It's an interesting dichotomy. You have all these years, these decades of, I'm going to treat them no matter what. Doesn't matter if they don't have insurance. I don't care. And then all of a sudden now you're a business owner and you're like, your life basically depends on it.
Which is crazy, because you're talking about the profession that can produce some of the highest student loans in all of America, but they're teaching you to not worry about money. And you're just like, can I take that back to my college and be like, hey, so we're not supposed to worry about money. So if we could be cool just kind of overlooking my student loans, that'd be great. That seems kind of backwards, doesn't it?
Yeah, it doesn't really work that well when I try to tell that to the bank. So they kind of tell me, yeah, that thing that you're treating as imaginary, no, it's real. Yeah. And you owe us all of it. Yeah. And guess what? So here's the really messed up part. A lot of people don't know this. So medical student loans, they are one of the only loans that cannot be discharged with bankruptcy. So, yes. And let's just say that after you look at compounding interest, I am sitting on over $500,000.
Wow.
Just from med school.
Dang, that's crazy, man. That is nuts. And I know. So it's funny because at the same time, you just said dealing with the money is the hardest part. And you'd think, man, I got this motivation to go out and just get all the money. But it's funny because you're approaching this as such from a genuine medical place where you'll spend your valuable time sitting one-on-one with a patient, regardless of necessarily how much you're getting paid, because the Dr. Jane mission, from what I gather, seems to be to not turn and burn and not to treat in the street, but to develop that ongoing relationship. Now, wait, is this your first venture into entrepreneurialism?
Yes, it is.
So a couple of questions. What's been the toughest part for you, I guess, in growing this little baby?
I think I honestly probably self-promotion, because it's very much like I said, it's just put your head down, work, take care of people. And now all of a sudden I'm having to be like, hey, look at me, come over here. And I'm like, that's not at all me. I'm just the guy that hey, let's go get beers and just hang out. So I think that's definitely been one of the hardest parts. Luckily, for some reason, I've just happened to meet some extraordinarily cool people. Actually, I may have told you, but actually, I feel like you're very responsible for all these because, Celeste Miranda. So the first time I ever heard her was on your podcast. And I sent her a very, a very ill-advised, emotionally charged email after I had not slept for almost 48 hours. And I was like, she's talking to me. And I sent her an email, and I was like, oh my God, that's one of those where I should have like wrote it down, crumpled it up, and threw it away. And I hit send, and I was like, oh God, that's just not going to be good. And she emailed me back 2 days later. She's like, we have to talk. And she has been absolutely fantastic. And I talked to Jared yesterday. So he says, what's up?
Oh, nice.
And he's been another one that I heard him on your podcast, and I was just like, dude, I have to talk to this guy. So while self-promotion has been like the hardest part of this, I think because of how cool by leaps and bounds everyone in this industry is, it makes it so much easier to reach out and just be like, hey, this is what I'm doing. Can we talk? And I mean, I haven't had a single person that's like, no, you're a stupid fucking idiot.
Yeah, in my experience, the only companies worth working with so far in this space are the ones that will pick up the phone and call you, no matter who you are, how far along you are in the industry. People in the industry know how tough it is, and they want to stick together. It's funny you mentioned Jared. I actually re-interviewed him yesterday, and we're going to have a new branding podcast coming out next week, which by the time, and this timeline's not going to line up with when the people are listening to this, which will be funny. So by the time this episode comes out, you can go back and listen to our next podcast, or newest. I'm trying to figure out how to say it. But Jared came back on the show, Jared Mirsky with Wick and Mortar. They have some really cool stuff that they're working on, and a new series that could be hitting mainstream cable TV. I don't know. We're finding that out soon. So good, man. I'm glad this has been a source for you, and you're part of the viewership and listenership. So I'm pumped on that. Getting back to Dr. Jane for a minute, again, drjane.net is where you can check out the products and reach out to Dr. Rick. I see you have the CBD products on your site.
Yeah.
How are you vetting these products? Because you say in your pre-interview, like, these pass your standards enough where you feel comfortable recommending them. Did you find them? Did they find you? What happens there?
A little bit of both, actually. So right now we have so there's. We'll say this. I'm only going to ever put stuff on there that I'm comfortable taking myself, and something that I'm comfortable giving my family. And so the first company that we put up there, PharmaCanna, is actually owned and operated by some of my neighbors. And so I got introduced by like my actual next door neighbor, and they're like, hey, since you're starting to do this stuff, I don't know if you'd ever be interested, but one of my friends actually, owns a CBD company, and they're a pharmacist, so they actually formulated all this stuff themselves. I don't know if you want to talk to them. And yeah, I was like, yeah, let's hook it up. But I mean, yeah, so this is something that I would not ever tell one of my patients, hey, you should check this out, without having first taken it myself. The company that I'm starting to work with now, and I'm hugely excited about, is a company called Little Pharma. They're out of New York. They are a cannabis and CBD manufacturer, lab, and distribution. They're all in one, but they are all organic, kosher certified. One of the things that I absolutely love, they are one of these rare companies that every single bottle, you can pull up the COA directly off of that. They're like, we have nothing to hide. Go check it out. And that instantly was like, I have to go see this. And this was another one that I knew them personally. I just didn't know that that's actually what the owners did. And no, they let me check everything out. Even down to the raw materials. And I was like, we have to do something. Like, I have to get this into my patients' hands. So, I'm really excited about them. We are actually in the process of getting them up onto the store now. So by the time this episode comes out, everything should be up and running. So look forward to how the patients and customers actually like that stuff.
And Little Pharma is a cool name. I'm actually really intrigued, and perhaps when we get off air, I got to get an email introduction because I'd like to see what they're all about, man. They could be an interesting interview for the show, absolutely, especially if they're doing it the right way. And then I got to ask a follow-up question. I know I'm going long here, but I'm fine with it. I
love it.
A follow-up question. Is there any plan down the line to possibly do a Dr. Jane line of CBD, be it white labeled or otherwise? Okay. I mean, you'd be crazy not to, it seems. So I'm not going to let any cat out of the bag. If you're listening to this and you're not watching the video, there was a slight nod, and we'll follow up. And you know what's going to happen is when that announcement comes, you're going to hit us back up, and we'll talk about it more on the show and what you guys are doing there. 2 more questions for you now. As an entrepreneur, what are you finding out, or what do you think from you being an entrepreneur is the most important quality that's helping you be successful? And it's different for everyone, but what comes up when you think of that?
In all honesty, I have always been a worrier. And I think that my kind of baseline level of anxiety definitely helps. Definitely gets in the way sometimes. And I have a very supportive wife that kind of slaps me around and keeps me in check when I need it. But in all honesty, I think it's probably the biggest thing in all honesty is knowing when to ask for help. Knowing that you really cannot do it on your own, even though, by definition, you're supposed to be the one man, the one woman show, and I'm bootstrapping this and I'm doing this, I'm doing that, but no man is an island. You have people around you, you have to utilize them, or otherwise you're going to die alone.
And then last question before we get you out of here, what does the future look like for Dr. Jane? What can you tell us about what's upcoming? You mentioned Little Pharma being added on the CBD side. But give me the long-term vision for this, man.
Yeah, so I am very fortunate enough to actually here very shortly, I'm going to start working with a few current and retired and former NHL players and NFL players, and we're doing a lot of athlete advocacy and outreach. I'm actually very much looking forward to working with a company called the Hockey Summit. They actually train a lot of the guys that are going to be playing in the NHL and kind of getting them up to speed. But I'm big on the nonprofit side. I love working with me being a vet, so I work with Mission 22, and that's something that we're going to continue doing. But we're building plans for world dominance. I'll say that.
I got to follow up, man, because I'd love to interview any of those hockey or NFL vets once this project gets up and running. Keep me in mind, because I'd definitely love to do that interview. And then just a side tangent, I've heard that the NHL and the hockey scene is the most cannabis friendly of all the professional sports.
Yes.
Can you kind of compare how it's regulated in hockey, if it is at all? I don't know how much drug testing.
So it is. It's a very progressive system. So what happens is players are all randomly urine tested. But the thing that they're specifically looking for are performance-enhancing drugs, so like steroids. Mm-hmm. And if anybody pops positive for those, it's like the NFL, you get, fined, possibly suspended. And that's just kind of an automatic thing. But what they also do is they anonymize the sample, and then they look for drugs of abuse. And the most common in the NHL are cocaine and THC. And those anonymous samples, if they test above a certain limit, they will then be separated, de-anonymized, and given to 2 designated physicians that are that make up the substance abuse program for the NHL. once they de-anonymize them, those two physicians will privately reach out to the individual player. They leave the league office, they leave the team out of it. And that's really the key thing. And they kind of reach out to the player and they say, hey, you pop positive. Is there anything going on? Is there something that you need help with? I.e., are you trying to self-medicate? Okay, because that's really the concern. Like, is there something going on that we should be worried about, or were you just partying and being stupid? Okay, so the player then has the voluntary option to either go into substance abuse counseling, or they can say, no, it was just a one-off thing. I'm cool. I'm straight. Like, it's fine. Just kind of, I'll do my own thing. If they decide to go into counseling or into treatment, then those two physicians, as part of the substance abuse program, then are given, at least through my understanding, they're given authority by the league to then levy penalties if the player then violates the terms of their substance abuse program. So, like, if they miss whatever meeting or whatever, then they can be fined. But it's just overall, it's a hugely progressive thing where it doesn't automatically one, ostracize the player, two, it doesn't penalize the player. It gives them an opportunity to actually come in for treatment. And you ask any substance abuse professional, the number one indicator for success as far as substance abuse treatment long-term goes is that the person needs to willingly come into substance abuse treatment. If they're not ready to give up smoking, give up drinking, give up whatever drug, they're not going to do it. Okay, and that's by far the number one thing.
Crazy. I mean, this is a whole new Pandora's box that we could open up. And I'm a sports guy, so I have a million questions. And I know that you've dealt with concussions. And bottom line is we'll have to get back on again soon because we'll have to have a lot more stuff to talk about. I have a lot more that I want to get to. What's so interesting about the NHL, just before we get out of here, is you mentioned things like privacy, voluntary. Like, those are words that aren't associated with the NFL or NBA or MLB. You test positive, and the media knows before they probably call you and tell you that you tested positive.
Oh yeah, no, that it's like, can you imagine if in just the real world, because professional sports is, let's face it, it's not the real world, but can you imagine if in the real world you had your local newspaper calling your mom and asking her for a quote like, hey, did you know that Rick tested positive? Like, she'd be like, wait, what? Like, no.
And then it's the front page of the news.
Yeah, like, no, that it absolutely can't work that way. Like, they're patients.
Oh, his name is Luis Enrique Liogier-Weyback. Second time just as good, right? Anyways, he is Dr. Rick, the founder of Dr. Jane. You can check them out, drjane.net. We'll definitely be having them back on the podcast because there's just so much more to talk about, and I can geek out all day on just this subject and going into professional sports. So I promise you, we will do a follow-up podcast down the line. But Rick, thanks so much, man. This has been great. We went way over. We almost probably doubled the time I said we were going to take on it. But thanks, man, and we'll get you back on the show again soon. Okay, man?
Hey, thanks a lot. So much. Appreciate it.
That's going to do it for us on the podcast this afternoon. Again, don't forget to go check out drjane.net. Scroll down. It's linked in the description of the podcast below. Also, don't forget to subscribe to the show so you don't miss out on future episodes, or you can go check out past episodes. Subscribe wherever you're listening, and go check out Rooted TV, airing on Cannabis Club TV, High Times TV, StayRooted.com, and of course our YouTube channel. But that's going to do it for us on the podcast this afternoon. My name is Tim Trumbull, and I'll remind you one more time: work hard, be humble, and stay rooted. We'll see you next week, everybody.